Hi everybody, I just wanted to talk to you briefly about the upcoming cardiovascular disease course that we have coming up. It's going to be an hour long and we've got a ton of stuff to talk about, so we're going to try to keep it to an hour and we'll see what we can get to. But just briefly, I wanted to sort of like give you a highlight reel of what we're going to be talking about so you know what to expect. So first of all, I think everybody understands the scope of the problem here. When you look at cardiovascular disease, it is by far the number one cause of death for both men and women worldwide, right? Not even close. So I also don't want you to be fooled into thinking that cardiovascular disease is only about heart attacks and strokes. There's a lot more to it than that. Cardiovascular disease manifests itself in a lot of different ways, including like poor muscle endurance, poor brain endurance, erectile dysfunction in men, cold hands and feet, vascular dementia. Vascular dementia is the number 2 cause of dementia after Alzheimer's. We'll talk about some more in a second here, but it's not just about heart attacks and strokes. But speaking of heart attacks and strokes, I just want to go through a couple real life scenarios that we've seen here in the office. A 55-year-old male eating properly, exercising regularly. He goes and gets a coronary artery calcium score and it's 250. Right? So people will be like, holy cow, that's weird. Why does he have such a high coronary artery calcium score when he's eating properly and exercising? Well, the reality is that's not weird. That happens all the time because it's not just about eating properly and exercising. There's so much more that goes into it, and we're going to talk about it in this upcoming presentation. What about this 48-year-old male who's tired all the time and he has body aches, right? And his dad died of a heart attack when he was 51. What should this guy be doing? What tests should he be getting done to see if he has cardiovascular disease? Because I'll tell you, it's not just about the cholesterol, right? So we're going to talk about that. What about this lady? She's a 56-year-old female, top executive. She's worked her whole life to get there, and she has a stroke, right? Now she has slurred speech. She can't put a sentence together. She's lost control of half of her body. Her career is over, right? She's worked hard to get there. And she has a long road ahead of her, right? Could she have seen this coming? Were there warning signs? Could she have had tests to see if this was coming? We're going to talk about those things. So my question is what about you, right? What's going on in your blood vessels right now? Do you know? What's going on in your brain? Are you having silent strokes? Do you know? When's the last time you had a good cardiovascular workup? And for that matter, what is a good cardiovascular workup? Does your doctor know? It's not just about cholesterol. But this is unfortunately the way it's worked out, is 6 of the 10 most commonly prescribed medications have to do with lowering cholesterol or lowering blood pressure. And that's not what it's about. In fact, most heart attack patients have normal cholesterol levels. And there's a lot of studies that say that. Okay, so it's not just about that. These are some other risk factors that I think most people understand as being risk factors for cardiovascular disease. But I put together this other list, and this doesn't even cover all of it, but these are big risk factors for cardiovascular disease. Some of them much bigger risk factors and better predictors of cardiovascular disease than cholesterol is. Okay, so we got to put the whole thing together. But the reality is, people think that cardiovascular disease is the silent killer. And for the most part, it is. But there's also some warning signs to tell you if you have cardiovascular disease. Like I said, poor muscle endurance, poor brain endurance, simply because of the damage to the vascular endothelium. And then there's like poor oxygenation to the tissues. But silent strokes, right, which could manifest as a sudden change in your personality, a sudden onset of restless leg syndrome, a sudden decline in your cognitive ability, right? And speaking of that, vascular dementia, like I said, it's the number 2 cause of dementia after Alzheimer's. And so people get this like stepwise decline in their cognitive ability because they're having these little mini strokes. Poor tissue healing. We see this in the clinic all the time. People with cardiovascular disease just don't heal as well. That's just the reality. So this was a paper that was just done in September of 2023, just looking at the risk factors for degenerative disc disease. And they looked at 111 different studies to say, what are risk factors for degenerative disc disease in the spine? Well, they said some of the biggest ones are atherosclerosis, hypertension, and high cholesterol. Okay? So what do you do about that? Well, of course, you throw statins at it, right? At least in this study, they acknowledge like there's a strong association between atherosclerosis and intervertebral disc disease, and it's because of a lack of blood supply because of plaque in the arteries. But it's just the same thing over and over again with statins. You know, if you have degenerative disc disease, take a statin. If you have cardiovascular disease, take a statin, right? If there's a pothole on the road in front of your house, take a statin. It's just, there's more to it than that. There's a lot more to it than just taking statins. So we're going to talk about that. Peripheral arterial disease is when people get like achiness in their legs when they walk a long time because of poor blood flow. Peripheral vascular disease like varicose veins. Erectile dysfunction in men. A lot of men don't realize that erectile dysfunction is usually a cardiovascular disease problem. In fact, erectile dysfunction precedes coronary artery disease in about 70% of the cases. And there's a lot of studies that say it's even more than 70%. And if we look at this, what causes erectile dysfunction? In 40% of the cases, it's cardiovascular disease. And then in another 30, it's diabetes, right? And we know diabetes and cardiovascular disease go hand in hand. So we could say 70% of erectile dysfunction is due to metabolic syndrome. But it's not just men. You have sexual arousal disorders in women. You have cold hands and feet. Hair loss can be cardiovascular disease. But let's be honest, sometimes it can be genetic too. It doesn't always have to be cardiovascular disease. But there's a lot more. So what we're going to cover in this course is a step-by-step approach of what causes vascular damage. So we'll look at what normal physiology is, what abnormal physiology is. We'll look at a preventive assessment. So if you come in here for a cardiovascular screen, we'll be doing some blood work, and we'll be looking at things other than just cholesterol. We'll be doing some imaging. We'll be looking at your stress. We'll be looking at your sleep. We'll be looking at your lifestyle. We'll be looking at your exercise. We'll be looking at your waist size. We'll be looking at a lot of different things that are risk factors. It's not just one test. There's do-it-yourself tests that you can do. And when we put together sort of like a risk analysis for someone for cardiovascular disease, we have to make it a composite score with all of those other things that I mentioned, like blood pressure and family history and all these different things. But if we were to pull one single thing out and say this one single test is the best predictor of cardiovascular disease, what would it be? Well, you're going to have to come to the presentation to find out, because we'll talk about it. And then what can you do to reduce your risks, right? What dietary changes can you make? And it's not that everybody needs to be on a Mediterranean diet, and it's not that everybody needs to be on a ketogenic diet or a vegetarian or a vegan or whatever, right? It's way more complicated than that. You can't have like a single solution to a multivariate problem. We have to look at everything, okay? What lifestyle things can you do to reduce your risks? What exercise should you be doing to reduce your risk? And there's a lot of supplements that have been shown to help reduce the risk of cardiovascular disease too. So I hope to see you for our upcoming presentation on cardiovascular disease. Sitting will be limited, so please email us and let us know that you'll be coming so that we can write your name down and reserve your spot. So I hope to see you then. Bye.